Hey guys, welcome to my presentation. Today, the objectives are going to be to learn proper posture and brace the core for safe lifting and patient transfers. And we're also going to learn how to strengthen the back safely using home exercises. So why don't I tell you a little bit about myself first and what makes me qualified to give this presentation. My name is Silvia. I got my master's and my bachelor's degree in kinesiology. And because of that, I am a kinesiologist with the BC Association of Kinesiologists. And recently, last summer, I completed a course at Douglas College. It was for healthcare assistants. It's called Body Mechanics and Client Mobility, so that I could really understand the type of training that healthcare assistants are provided when they go through their training to do all these patient transfers. Got some other credentials as well, but I won't bore you with that long list. Most relevant would be for a few years, I worked in a physiotherapy clinic where I helped injured workers return to work after injury. I saw a lot of care aides and other healthcare workers through that program. Often they got hurt. Either they hurt their back or their shoulders or sometimes something else. And the most challenging part of return to work for them in terms of physical abilities was going back to do patient transfers. And as part of my job, so that I could really understand the types of positions they have to be in, I actually went to people's workplaces, went to a lot of care homes, went to hospitals and similar locations so that I could understand the job. And that is what prompted me to want to give this talk, because I understood that proper body mechanics are super important, and actually being really strong enough for the job is also super important in order to help people do their jobs effectively and stay injury free. So I'm sure you guys have all heard this phrase before. It's probably said a lot: lift with your legs, not with your back. It's a phrase that's really actually poorly understood. When you don't have the time to actually train people to become strong and resilient, especially in their backs, you guys, don't get personal training sessions or anything. It makes sense to really focus on lifting technique, and it makes particular sense to focus on protecting the back, given how common it is for people to get back issues. But this is a problematic phrase for a few reasons. So one is that there are specific times when squatting is not feasible. For example, if you're in a tight space or if you have to reach over a bed, for example. Another reason why this is problematic, this use your legs, not your back phrase, is when people try to keep their torsos upright, they sometimes end up hyperextending the lumbar spine, which is also problematic. And I'll talk about why that's problematic later. And third issue is that squatting and lunging, while they do reduce the work of the back, they are difficult for people with knee issues. So you're shifting the work from the back onto the knees, which is not necessarily a bad thing unless you are particularly sensitive to knee issues. So this video shows two different methods of lifting. Which muscles are working in each of the situations? If you think that the one on the left uses the back while the one on the right uses the legs, you're correct, but only partially. Truth is, the back muscles are always involved in lifting, and even simply standing upright or climbing the stairs, for example, uses the back. So you'll see in these animations of the skeleton with muscles that you'll see the leg muscles, you see the back muscles, and when the muscles turn green, they are working a little bit harder, whereas when they're red, they're a little bit more relaxed. So in both situations, the back muscles and the leg muscles are working. Even in the animation where the skeleton's climbing the stairs, you can see the back muscles turning on as well. So even hip hinging, or what you see on the right, or what people refer to as using your back, it primarily uses the back of the legs and the butt to generate most of the strength if you do it properly. So when it comes to safe lifting, there are a couple things you want to consider. Number one, how strong is your back? So intuitively, it makes sense that the effort required to lift something is going to depend on how strong you are. And you want to make sure that you're doing only what you can handle, so that you can, because if you do more than you can handle, your risk of injury is higher. So it makes sense for you to select tasks based on your physical abilities to avoid injury risk, but rarely do people consider the other side of the equation, which is building strength and thus building injury resilience. If you are able to lift 140 pounds, like what I'm showing in this video on the left, then picking up a 20-pound bag of rice and lifting it into your car trunk is no problem. The second thing we want to consider when it comes to safe lifting is what is actually happening in the spine. So with heavy and or repetitive tasks, form becomes much more important, as well as more efficient for lifting. So here is an example of what you don't want your back to look like when you are lifting either a lot of weight or lifting repetitively. So in this image, you can see that the spine is totally not in its, it's in a different shape compared to when you're standing. So what we've got there is, it's called spine flexion, where the spine is bent forward. And when it comes to the low back, risk for injury and risk for degenerative changes increases when there is significant movement between the segments of the spine. So your spine is made up of, composed of several bones, and in between the bones there can be movement. So when you are bending the lumbar spine or the low back spine forward or bending it sideways, what happens is, there's these things called discs in between these bones. And when you are bending the spine, it's going to compress the disc. So if you're bending forward, it's going to compress the front part of the disc. If you're bending sideways, it's going to bend the side of the disc. And, that in itself is not necessarily a problem, but if you do it repetitively or if you do it with heavy weight, these lumbar discs, they may deform and they may shift. And when the discs deform and when they deform and shift, they can actually pinch the nerves. And that's why people may get symptoms. So they might get pain, but they also might feel like weakness, or they might feel pain. And sciatica it's a common manifestation of what happens when you get a pinched nerve due to issues in the lumbar spine. So we talked about bending forward. Now, if you do the opposite, where you arch the low back, that can also be problematic. So like what you see in this photo, this is me lifting with a really, really arched spine. So it's actually still a different shape compared to what I would be doing if I was standing. So this is me standing, and then in that photo, you can see that the back is more arched. So that in itself can cause discomfort and can eventually lead to stress fractures in those bones of the lumbar spine. So this is when you get a fracture of these low back bones due to this, arching of the back. It's known as spondylolisthesis. And if this happens, the fracture can cause the bones to actually shift relative to each other. And this is known as spondylolisthesis, and that can cause some problems, including the same pinching of the nerve that we saw in the animation before. So if these bones shift, it can also lead to pain and weakness due to compression of the nerves. Now's the part where I go through some movements and exercises to teach safe lifting as well as to strengthen the back. So I really encourage you to participate with me, because only through doing you are going to learn. Just watching itself is not going to be enough. So first objective is to learn how to control the spine. I mentioned that problems can arise when you're lifting heavy or lifting repetitively and there is movement in the spine. So we want to learn how to control the spine, but before we learn to control the spine, we actually also have to learn how to move the spine. So you're going to stand up and you are going to do what we call pelvic tilts. So in these pelvic tilts, you are going to stand, you're going to think about arching your back and then flattening the back, okay? So you're going to put your hands on your hips. You're going to think about first pointing the belly button towards the floor, arching the back, and then you're going to do the opposite, which is to point the belly button up to your nose and flattening the back. So this is called anterior tilt, where you're arching the back, and then we're going to do posterior tilt. So you should be able to do this movement without actually moving the shoulders. So what I don't want to see is, moving the shoulders. We want to learn how to control the pelvis while keeping everything else stable for this particular exercise. If you have trouble doing this, what you can do is you can stand against the wall. And when you stand against the wall, you're going to basically put your feet in front of the wall by about a foot. You're going to put your shoulders and head against the wall, hip bones against the wall, and then you're going to do the same thing where you're flattening and arching the back, and head and shoulders stay on the wall. Now that you've learned how to control the spine through moving, we want to learn how to actually keep the lumbar spine or the low back spine from moving and learn how to bend safely. So the issue that arises with bending forward and doing it repetitively with weight is if your spine actually bends while you're doing it, either this way or the other way. What you want to do is keep everything rigid in the spine and then actually bend through the hips. So it is very, the hips are meant to move a lot, and the hips are what should actually create most of the strength when you are lifting. So to learn how to do this, we are going to learn what's called a hip hinge. So what you can do is you are going to grab a chair or a bench, or you can use a coffee table, and you are going to stand in front of it. So what you're going to do is you are going to grab a chair or a bench, or you can stand in front of your bed, and this will sort of mimic what you're doing at work as well. You're going to stand so that the knees are touching, okay? And now you are going to push your butt back, bring your head down. Okay, notice that my hips go back, my head comes down. My knees are bending, but they're bending softly. Most of the movement is actually happening through the hips. So the hip joint is acting like kind of like a hinge. That's why it's called a hip hinge. And as I bend forward, my spine, the shape of the spine stays the same. So I'm not doing this where I round the back. I'm also not doing the opposite where I am, sticking my butt out and arching my back as I do this. So what I like to think about, what I would recommend you think about is thinking about keeping, so that you got your hip bones at the front, you got your ribs at the front. Keep the space between your hip bones and your ribs, keep them the same. So it shouldn't separate, it also shouldn't come together as well. So you're going to practice this hip hinge. It may be helpful to actually put if you've got a broomstick at home or some other stick, you can place that along your back like so. So I'm going to get it to touch the butt. It's touching my shoulder, between the shoulder blades, and touching my head. And I want to maintain these 3 points of contact as I hinge at the hips. So the dowel stays on my butt, stays on my head, and I've still got this little bit of a gap behind my low back, which is the natural shape of the spine. And as I reach down, what I'm feeling is as I reach the bottom, I'm feeling the back of the legs getting stretched. As I stand up, I also feel those same muscles working, and I feel my butt working. So if you do this properly, you should feel those glutes doing most of the work. The reason it's important for us to learn how to hinge is exactly for those situations where you cannot do a squatting movement in order to do what you need to do. So this is teaching how to keep the spine rigid, and use your legs. Let's say you're doing, a patient, you're reaching to roll a patient, or you're performing a slide from a stretcher to a bed or something, and you actually have to be reaching. Now that you have an idea of what it means to do a hip hinge, by keeping the spine nice and rigid as you bend at the hips and use your legs to get the strength, you are going to do your first exercise that helps you with strengthening. So this is strengthening that is really relevant for your day-to-day activities, including at work. This is called the deadlift. You'll see people do it at the gym, but you can also do it at home using various objects at the home. So here I've got this bag of rice, and you can use a bag of rice or a heavy jug of water or something, or a box filled with stuff. Those can all work. So you're going to start with the weight on the floor, the object on the floor, and you're going to use that exact same movement to lift the object. So I'm going to get as close as I can, and I'm going to hinge at the hips, pushing the butt back, bring the head down. I'm going to grab the object and stand back up. As I stand back up, I've noticed that it's the legs and the butt that are doing the work. And as I lower back down, I'm really paying attention to my form as well, keeping the spine nice and rigid the whole time. And as I stand up, what helps me to use those legs and the glutes more is to think about actually pushing down into the floor as I stand up. So I hinge at the hips, grab the object, and as I stand up, I'm thinking about pushing the floor down and away from me. That helps to engage the legs. So that is called the deadlift. If you happen to have a dumbbell or other weights at home, you can use that as well. Same thing. Gonna get nice and close, and I want to make sure to mostly feel my legs doing the work. So this teaches you how to use the legs properly. But like I said before, the back muscles still will be working. So as you get stronger and stronger and you gradually use more weight, those back muscles will be getting stronger as well. And the great thing about this movement, it is so relevant for day-to-day activities. All right, so the next thing we're gonna do is learn how to brace. In other words, you wanna create a natural weightlifting belt. When you have your core muscles working properly, it's actually gonna act like a belt to stabilize the spine. So what you're gonna do is you are going to, I recommend you try this when you're sitting down. You're gonna put your hands like so, and you're gonna just tense up the muscles as if somebody was about to punch you in the stomach. So when you tense up the muscles, you're activating those core muscles, and that's going to act like that natural weightlifting belt. Pretty simple. So when you are doing some heavy patient transfers or doing some heavy lifting, think about tensing those muscles and then going about to do the action. Now you're going to take that bracing that you learned and you're going to apply it to an exercise that replicates doing a patient transfer. So I've got this band, I've just attached it to a table, but you can attach to anything that's stable. I'm going to hold on to the band, make sure that there is a little bit of tension as I start, and I'm just going to create that, I'm going to brace and I'm going to step sideways. And as I do so, it's actually the legs that are helping me step to the side. And if I didn't have my core muscles bracing, what would happen is like the band would just pull me, right? It would just pull me towards it. So I'm going to keep the core muscles braced, use my legs to generate the movement as I step. And if you were to do this properly, you would probably feel your butt muscles working to do the movement. So especially on that side that's closer to the band. But when you're doing a patient transfer, it is important for you to be able to brace, and power should be coming from your legs. The arms should just be stable. Okay, so when it comes to safe lifting, keeping your back safe, what are the things we should always keep in mind? One is keeping a rigid, neutral spine. So learning how to keep your spine rigid as you bend at the hips and bend at the knees, and keep your spine braced by engaging those core muscles. That's principle number one, especially as it becomes heavier. Number two is get stronger. The stronger your body is, the easier your job is going to be, and the more you're going to be able to do without risking injury. And number three is you want to not do too much too soon. So anytime you're introducing exercise or doing any sort of exercise program, you don't want to, do a whole bunch at once. You want to be really gradual. You want to progressively make the exercises more challenging over weeks and months. It is worthwhile to get guidance from a good kinesiologist, physiotherapist, chiropractor, personal trainer, or other movement specialist to help you keep your body healthy and strong long term, especially if you are already in pain. When you can move better and you have better physical activities, not only do you reduce your risk for injury, but you can do more of what you want without feeling limited by your body. This is why I am so passionate about this topic, because I don't want people to get injured, but I also don't want them to feel like they can't do stuff because they're afraid of injury. Now that you've learned about the importance of strength training for your back to bulletproof it from injury, what can you do next? Well, I created a free resource for you that includes the exercises that we went over today. All you have to do is go to my website, defytimefitness.com, enter your email address, and I will email you the program for free. The second thing you can do if you want a more comprehensive strength training workout that you can do from home without any equipment, I've got this Getting Started with Strength program. Normally I offer it for $59. For the 3 days following this presentation, I will offer it to you for just $29. That's more than 50% off. And again, go to the website, you'll find the details on how you can purchase the program.